Therapy. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. Now let's start with the mindfulness based cognitive therapy, that is MBCT. So mindfulness based cognitive therapy is a type of psychotherapy that involves a combination of cognitive behavior therapy, meditation, and the cultivation of a present oriented non judgmental attitude called mindfulness. MBCT was developed by a therapist, that is Jindal Segal, Mark Williams, and they felt that by integrating cognitive therapy with a program developed in 1979 by John Kabat-Zinn called mindfulness-based stress reduction therapy could be more effective. So in this video, I'm going to discuss about the techniques, uses, and benefits of the mindfulness-based cognitive therapy. It also covers the efficacy of this approach and other things to consider before you try a CBT mindfulness approach. Let's talk about the techniques in mindfulness-based cognitive therapy. So mindfulness-based cognitive therapy builds upon the principles of cognitive therapy by using techniques such as mindfulness meditation to teach people to consciously pay attention to their thoughts and feeling without placing any judgment upon them. There are a number of mindfulness techniques and exercises that are utilized as a part of MBCT, and some of these include first, meditation. So people may practice guided or self-directed meditation that help them gain a greater awareness of their body, thoughts, and breathing. Second, body scan exercise. This involves lying down and bringing awareness and attention to different areas of the body. People usually begins at their toes, moves up through the body until they reach the top of the head. Third is mindfulness practices. So mindfulness involves becoming more aware of the present moment. It's something that can be practiced during meditation, but people can also incorporate these activities into the things they do every day. Next is mindfulness stretching. This activity involves stretching mindfully to help bring awareness to both the body and mind. And last technique is yoga. So MBCT may also encourage people to practice different yoga poses that can help facilitate mindful stretching of the body. So people might be taught what is known as the 3-minute breathing space technique, which focuses on 3 steps and each 1 minute in duration. First is observing your experience. How are you doing right now? Second, focusing on your breath. Third, attending to your body and physical sensation. Okay, so this is a 3-minute breathing space technique. Now, next we'll talk about the what CBT mindfulness can help with. So researchers suggest that mindfulness-based cognitive therapy can be effective in helping individuals who have experienced multiple episodes of depression. It can it has also been shown to be effective for the other issues including anxiety disorder, bipolar disorder, low mood, unhappiness, depression relapse prevention, treatment resistant depression associated with the medical illnesses. Now we will talk about the benefits of mindful based cognitive therapy. A primary assumption of CBT is that, sorry, a primary assumption of cognitive therapy is that thoughts precede mood and that false self beliefs lead to negative emotions such as depression. So, MBCT utilizes elements of cognitive therapy to help you recognize and reassess your patterns of negative thoughts and replace them with positive thoughts that more closely reflect reality. This approach helps people review their thoughts without getting caught up in what could have been or might occur in the future. MBCT encourages clarity of thoughts and provides you with the tools needed to more easily let go of negative thoughts instead of letting them feed your depression. So, much like cognitive therapy, mindfulness based cognitive therapy operates on the theory that if you have a history of depression and become distressed, so you are likely to return to those automatic cognitive processes that triggered a depressive episode in the past. The combination of mindfulness and the cognitive therapy is what makes MBCT more effective. So mindfulness help you observe and identify your feelings while cognitive therapy teaches you to interrupt automatic thought processes and work through feeling in a healthy way. Now, another therapy we have is psychoanalytic therapy. So, let's talk about it. So, what is psychoanalytic therapy? Psychoanalytic therapy is a form of talk therapy which is based on Simon Friend's theory of psychoanalysis. The approach explores how the unconscious mind influences your thoughts, feelings, and behaviors. Specifically, it examines how your experiences may be contributing to your current experience and actions. Psychoanalytic approaches to emotional disorders have advanced a great deal since Freud time. Is as the reservoir of desires, thoughts, and memories that are below the surface of conscious awareness. He believed that these unconscious influences could often lead to psychological distress and disturbances. Now, what is a technique? Let's talk about the psychoanalytic technique. So, people undergoing psychoanalytic therapy often meet with their psychoanalyst at least once a week. They can remain in therapy of techniques to gain insight into your behavior, and some of the more popular techniques include first, dream interpretation. So, according to the most important psychoanalytic technique, you often refer to dream as a royal road to the unconscious. Psychoanalysts may interpret dreams to get insight into the workings of your unconscious mind. Second technique, free association. Free association is an exercise during which the psychoanalyst encourages you to freely share your thoughts. This can lead to the emergence of unexpected connections and memories. Third technique is transference. So, transference occurs when you project your feelings about another person onto the psychoanalyst. You will then interact with them as if they were that other person. This technique can help understand how you interact with others. And psychoanalysts spends a lot of time listening to people talk about their lives, which is why this method is often referred to as the talking cure. Now, what psychoanalytic therapy can help with? So, psychoanalytic therapy may be used to treat a number of different psychological conditions like anxiety, depression, emotion struggles or traumas, identity problems, self esteem issues, self assertion, psychosomatic disorder, relationship issues, sexual problems, self destructive behaviors. Now, the benefits of psychoanalytic therapy. So, what makes psychoanalytic therapy different from the other forms of treatment? A review of the research comparing psychoanalytic approaches to CBT, that is cognitive behavior therapy, identified seven features that set the psychoanalytic approach apart. First was focus on emotion. Second, it explores avoidance. Thirdly, it identifies recurring themes. Fourthly, exploration of the past experienced. Next, it explores interpersonal relationship. It emphasizes the therapeutic relationship. And last, it is free flowing. So patients are free to talk about their fear, their fantasies, their dreams, and their desires. Okay, so as with any approach to mental health treatment, psychoanalytic therapy can have its pluses and minuses. So before deciding on this approach, it's important to take these factors into account. So at last, I only want to say that mindfulness based therapy are effective for reducing stress, anxiety, and depression, and they are also used in pain management, improving emotional regulation, and enhancing overall well being. And on the other hand, psychoanalytic therapy is used for the individual seeking a deeper understanding of the emotional and psychological issues, including unresolved conflicts, relationship difficulties, personal growth. Video informative and helpful. So please give it a thumbs. So please give it a thumbs up and subscribe for more content related to health and well-being. If you have any questions or personal stories to share, so feel free to leave them in the comment box below. So until next time, take care and stay safe and stay healthy. And yes, thanks for watching this video.